friends with us, Dr. Prabha Bhattacharya Madam and Dr. Manjula Rohatgi Madam. Welcome, a big welcome to both of you madams today on this program. Welcome, ma'ams. So to begin with, I have many questions for both of them. So to start with, I will start with Bhattacharya Madam. Madam, are you with us? Please unmute yourself, ma'am.
मैम अनम्यूट कीजिए आप. नंदिता मैम को अनम्यूट कर दीजिए.
Hello.
Hello, good evening, madam. Welcome to the program.
Yes. I first of all thank you all, Dr. Ankita and Dr. Marathe, that you have taken such a lot of trouble and collected all these things in a detailed manner, spending such a lot of time. Thank you so much, both of you.
It's a pleasure, ma'am. It's a pleasure to be with you here on this program today. And it's wonderful seeing you after such a long time. Madam, to start with, I'll start with a question to you. We all know that our childhood days are always very interesting and memorable days. I guess everyone sitting here must be feeling the same, that they have been memorable. I mean, whenever you think back, you go back, you feel, oh, bachpan, kahan gaye wo din. So, madam, please tell us about your childhood days, your birthplace, schooling, college days.
See, my father was a government officer, so he used to get transferred from one place to another. So my schooling is done first from up to class 5th in Holy Cross Convent, Amravati. And from there, we were transferred to Bilaspur, and there we studied in Burgess Memorial School. And from there, he was transferred again back to Nagpur. And Nagpur was the place where I studied the whole from 11th class till I completed my MD. And of course, my whole career. I never moved out of it for those many years. So convent was really good. And I loved my teacher, class teacher, who was a Spanish lady. They wanted me to change to some other section or other class. But I insisted that I want to stay on in this class only because I love my teacher very much. So they accepted my request and made me stay there only. So I was the one who was insisting on them that I want to stay in this class only with my teacher. In Burgess Memorial School, it was really a girls' school, and they used to teach us lot of things, right from sewing, stitching, knitting, everything, and plus education also. So it was, I think it's good for every one of us to learn things at that stage, so we can continue with that in a later life. From there, I came to Nagpur, and that was a Providence school, girls' school. That was also a girls' school. My whole education was in girls' school only. And there, initially, the sister, nun she was, she never accepted me. I don't know why. But then my father was a government officer. So there was a rule that any officer transferred from one place to other place, they should be given admission. The children should be given admission there. So my father, his sister said, nun said, my headmistress she was. She said, I have got no space in my class. So I cannot admit your daughter. So what my father did is that he took a small table and a stool to the school, and he said, she will be sitting here, you teach her. So actually, she got very annoyed, but then the whole class and my teachers, they loved it so much that when I used to sit on the table and that stool and table, all my classmates used to come down and sit close to me so that I don't feel lonely and bad. So that those days were really very good. And where once she saw that this girl is really good in her studies and coming first, because the main problem with that lady was the nun, that she loved one lady girl, Arti Datta. She used to come first every time. And when I came, she lost her position and I got first. So that was one thing she very got annoyed, but then she realized that that was not the proper thing. She came on a tanga to my house and thanked my father that I have accepted your daughter as a student of my school. Of course, from there, I completed my education in Institute of Science, 2 years of science. From after doing 11th class, I got into the Institute of Science, and 2 years I spent there. All the teachers were really very good. They loved me like anything, and they used to help me also, always. From there, of course, medical college. And you know that medical college is a place where it's a huge building with number of people, number of different types of people. But then there also, I got a lot of love and affection. I really remember my school days and the hospital, college days, especially medical college. I loved my medical college so much. Each and every brick of that thing reminds me the future, the past of the past days that I have spent in there, and completed my education till MD. Did my MBBS, DGO, and MD. And got job also there immediately after the MBBS, and worked as a registrar for 2.5 years, and then got a lecturer's post, and of course the subsequent one. But I still cannot forget the days that I have spent in those surroundings, in those teachers also were so wonderful, because I have never come across that type of teacher in my life throughout. Dr. Devi was my mentor, and she really did. She was very strict, actually, looking at her. But in her heart, she was very soft and used to treat her as their children only. And we also said Devi Amma. We never said Dr. Devi. Devi Amma.
So nice.
And of course, Dr. Shastrakar, I cannot forget her. She also was a very loving teacher and a very loving nature. Everyone thought she is very strict and she is not soft, but I found her very good. Even after she retired from the hospital and was doing her practice here in Dharampet area only, close by, Giripet, I used to go and see her and talk to her because I missed her very badly. And of course, after that, in the few things that I would like to address here is that one night, in the middle of the night, one patient got admitted with ectopic pregnancy in shock condition. She was O negative. And at 2 o'clock in the night, it was so difficult to get that blood. And she was in a condition of shock. So we had to do auto transfusion. And really it worked so well. And we were so happy. So once the patient gets well, the doctor is the one who really gets complete satisfaction and happiness. And these feelings should be realized by the patient itself. that we love them so much, we care for them so much, and we see that they become all right. So that is the real happiness that we get. One more case I would like to quote here is a patient coming from a village where they have breech delivery. After coming, head was obstructed. They cut the neck. They have removed the lower jaw also, but could not deliver the head. So it was so difficult to remove that head because the cervix has started closing down, and to get that head out because all maceration now, and we cannot open up the abdomen because that will spread the infection. So just with the Ellis tissue forceps, long one, we tried to remove the bones one by one in pieces and then delivered the head properly. So these are the things which we never see today, because we have seen all embryotomies, all sorts of embryotomy, because those days the obstetric practice was really not to that extent, especially in village areas, and patient with shoulder prolapse, hand prolapse, shoulder presentation, hand prolapse, and we have to do embryotomy, decapitate the head, decapitate the spine, make the baby into two pieces and deliver the baby. Because in such cases, it is impossible to do cesarean section and save the life of the patient because of the severe infection she has already received by the dye that those who have handled her. So these two cases, I can still remember that the obstetrics have progressed so much, so well, and with the ultrasound, the whole thing has changed. Whole obstetrics have changed and gives you a lot of information. So that is really a boon to us now at present.
Ma'am, you didn't have any doctors in the family. So how did you decide to become a doctor yourself? What was the inspiration behind it?
I don't know why. From the beginning, I used to serve people, like to serve people. There was no one in the family who was doctor in my family, my mother's side, my father's side. But whenever I was asked in the school, what do you want to become? I used to say, I want to become a doctor. So I don't know, it is the instinct that made me a doctor. And of course, I feel I have done whatever one doctor can do for the patient.
Yeah, your journey has been really amazing, right? From college days and then to a professor and then to a private practitioner as well, and
Yes.
practicing almost till date. So it has been wonderful, ma'am. We wanted to know more about Dr. P.K. Devi, madam, because she was your teacher, and you mentioned that you called her Dr. P.K. Amma, Devi Amma.
Devi Amma was really an orthopedic surgeon, FRCS. But she learned obstetrics in such a good manner and used to teach us so well, and was good in surgery. If I talk about Dr. Devi Amma, even Dr. Shastrakar was so good in her surgery, because we still admire the operation they used to do in cancer cervix, Shorter's operation. Dr. Shastrakar used to do beautiful operation and repair of VVF. So many things I have learned from them, and really very thankful to them, because I was lucky to get good teachers to teach them properly. And just a minute. Huh?
It's really amazing to hear these stories and incidences from you, ma'am. And yes, you were really lucky to meet them and see teachers and meet teachers like Dr. P.K. Devi and Dr. Shastrakar. We would only know about them from you and teachers like you who met them.
For the teaching. And really, they used to love me so much. I cannot say that, but I still miss them so much. today also, whenever I work, whenever I do anything, even putting a hand on the patient's abdomen, she used to say, "ये ectopic pregnancy है, secondary abdominal pregnancy. So can you do that?" You start running for the sonography. So that clinical experience was really good, extremely good. And I admire for that. Because putting a hand on the abdomen saying that this is not intrauterine pregnancy is not an easy job.
Yes,
So we were lucky to get teachers like, and they were sacrificing for the whole student, whole hospital. They really did a lot of job for the hospital and the patients, of course.
yes, we would have been, I mean, we are lucky to meet them through you.
Yes.
Meet madam and both Shastrakar madam and PK Devi madam through you and know much more about them. Madam, another question to you is, how was your journey as the president of the Nagpur OBGY Society?
That OBG was just coming up then, and all juniors were there, but very few people were there. We used to arrange, lectures and all, but not to that extent what you go for. And it was good. I really loved to be a president of the society where people were all together, all helping each other and trying to do best that they can.
Any special memories of your tenure which you would want to share as NOGS president or of Nagpur OBGY Society, colleagues, anything special?
I think we had that conference in 1966, All India Obstetric Conference. That was really very good. Very well arranged also. And Dr. Joshi, what was her name?
Kamala Tai.
Kamala Tai
Joshi.
Kamala Tai Joshi, she used to work so hard, collect such a lot of amount from the pharmacist, and she sponsored the whole program by her contribution. She was really good. All of them work for the society.
We were not born also, ma'am, that time.
No.
1966, I was not there.
We were
I
not
was
born.
also not born.
You are a modern generation, my dear. So that was really remarkable. 1966, All India Conference.
You have been a professor, madam, a postgraduate teacher at medical college. You have taught a few generations of students. According to you, what should be the qualities of a good student?
Good student you want or good teacher you want?
Good student.
Oh, good student should respect their teacher first and take proper attention. They should not, you see now in the lecture hall what lot of noise they make. You should attend to their lectures properly, attend the way they teach us, try to teach us like teach other people also in that manner, and well behaved, well mannered, very polite, soft spoken, easy to teach them, always willing to learn things from their teachers. That should be the quality. That is what I feel.
Yes, absolutely right, ma'am. And what should be the quality of a good teacher also? Now that you asked me, what should be the quality of
good teacher, the one who directs the young generation on the proper path, proper education, proper habits, how to talk to the patients, how to talk to the senior. All these things are very good because these things we learn from the teachers only, So the teacher has got a great responsibility, and really they do a lot for the society. That is really important.
Yes, ma'am. We are really blessed to have teachers and seniors like you with us and who are always guiding us, ma'am.
Absolutely.
stitching, gardening, cooking. Many wouldn't know. Madam still stitches and cooks and also operates regularly. Yesterday she did a hysteroscopy, in fact. So Madam is into. There are really 3 cheers to Madam.
I want my juniors also to learn things which we have learned from our seniors. And I just cannot sit at home quietly. I'm still quite active, and just sitting at home will be wasting my time. So long I live, at least I can do something
That's very nice. In fact, I have some pictures which I'll be sharing later. They're amazing pictures, and everyone would be really. We have two inspiring figures with us today, both ROHATGI Madam and BHATTACHARYA Madam. And
Ankita,
how did you actually bring a balance? Yes.
Ankita, I think she's not there. Network. Her window is frozen. Have we her network issue or something? We've lost her here. She's not here. See, her window is frozen.
Yeah, I just happened to see that her window is frozen.
Me Nandita ma'am na call karte 1 minute.
Yeah. ROHATGI ma'am.
Ma'am, you have to unmute yourself. ROHATGI ma'am, you need to unmute, ma'am.
That's I've done. I've done it now.
Yes, ma'am.
Okay,
Yes, we can hear you now.
Yeah.
Wonderful to have you with us, madam. Good evening once again.
Thank you very much. Thank you.
As I was just talking to BHATTACHARYA madam, and we were talking that childhood memories are very precious. These are the memories which are etched on into our minds. And these are usually the ones who have brought a strong impact on our future days also. So tell us, madam, about your childhood memories. Your family lived in wartime Calcutta and they were involved in freedom struggle. You were a big family with many brothers and sisters. So tell us about those days, ma'am.
Well, I would say that my childhood was one of the most beautiful period of my life. In fact, we were very young that time when we were so many children. We were among 11 brothers and sisters, 6 brothers and 5 sisters. And I was one of the twin in between. And we were just one of those who were neglected from a thing, sort of, because we were youngest in everything. But I would say that in spite of that, we had a lovely childhood. We played together with my brothers. There was no schooling. The Panditji used to teach us because there was no school. So there were 11 children sitting on Gandhi, and this Panditji used to be a residential Pandit. So he was there all the time and taking care of us. And what we did was we used to run away, then play gulli danda, tops, flying kite, and all that. And then he would send the servants go pick them up, bring them. He would pull us and bring us back to the class. But it was not a class, but it was like a fun thing. And my younger brother, he was also with us. And my elder sister, she was in the other group because she was old, and she would allow us to meet with them. And more than that, as there was in 1942, we only knew that there was something going on wrong. That was one Quit India movement, freedom fight, and all my relations most of them were in jail. And then there was a 1942 famine in Bengal, which was really, we showed us as a little person that how difficult it was for the mother when she saw the children dying on the road just outside the house because of hunger. Every morning there was a stream of people coming from nowhere, I do not know. They would come, the whole street was full. Then they would sit in a row, and my father used to distribute this chana. Everybody is waiting for one mouthful of chana so that you could have some breakfast. The children were given free milk, and then one homeopathic doctor who could treat the little children or people who were not well. But by the evening, there was a big truck used to come. They used to push half, 50% of them into the truck like a bakri and go where, I don't know where they used to take. But next morning again, there was a same lot of people on the street. So this was a scene which has impressed me so much, that how the poverty and hunger can kill a person and take away all the happiness. This thereafter there was a World War II. The Japanese attacked Bengal, and of that the Calcutta was the first city which was destroyed. We could, we were there, and we could, every night we had to. It was a blackout days. We had to run with our chadar and all that down into the shelter, and stay there till the siren used to be again to come out. So this was another thing which we learned, that he, there is a period in life where you have, but we were happy. There was no school. We were very happy, and we wanted, at the end, we wanted to go to school. Finally, since there was no school in Calcutta, my school, which my sister used to say, they'd gone to Ranchi, Delhi, and all other places, but then Calcutta, there was only one school, a missionary school, Loreto House. Supposed to be very fashionable and up to date. My father, who used to wear a dhoti and long coat and topi, he took us to the school and said, I want to admit my two daughters. And Mother Superior got very upset seeing him in a Indian dress with that dhoti. He said, sorry, we don't admit anybody with this type of dress. So we came back, but later on my uncle, who was in a big English firm, and we used to wear a suit and all that, he took his three daughters, we also got admitted. But I'm glad that we were there, we were admitted. Since we had not studied in French anything, we were admitted in class 3. Didn't know a word of English, but we learned slowly. Within 6 months, we were able to speak English very well. Then it was a real thing, because there were not very many children, but it was we were up to the class 3. The Indian children were separated from British children. They had different sections, and the Indians had different. That we didn't like, because they had a dollhouse and we didn't have a dollhouse, and many more toys, and we didn't have that toys. Anyway, when we went to the second standard, then there used to be exam, and we always found that first 3, 4 Indian girls used to get first, second, third, fourth, and thereafter all those British girls, Anglo-Indian girls were there. Anyway, we studied for 3 years, and thereafter there was riots in Calcutta, and there was so much running around, people being killed by drivers. So again, we didn't go to school for that time also. For about 6 months, we were not going to school. Finally, it was like missing school, not studies, and it was very difficult. The life was difficult that time. And उसके बाद हम लोग we decided that we must be in a good school where we can study also. In 1947, after independence, my father shifted me to another Indian school, Gokhale Memorial Girls School, which was run on the basis of all the girls who will be trained. When they pass, they will become the wives of the politician when we get independence. That was the Miss Bose's say. So we said, we thanks God, we have come to a school where we are respected. And after that, because outside the school, there was a PG hospital where it was written, dogs and Indians not allowed. That is to it is more than anything else, because we were considered to be dogs in the eyes of the British people. That was something which was couldn't be tolerated, and that made us more what you call to fight for freedom that time. Being there all that every day, every week, 3 times we'll go for Prabhat Feri, singing sort of in songs to get the independence and all that. Anyway, we studied there till metric, and then finished our whole 10th class there, and thought of doing medicine. That time I was very young, and I had thought of becoming a doctor, because my father was diabetic, severely diabetic, and he was in coma twice, and was recovered with great difficulty. And that time there was no sterile syringes like we have now. I had to every day I had to boil the glass syringe and the needle and take out this give syringe according to what my father said. 40 unit de dena. I didn't know what the 40 unit means, but 40 units.
We cannot hear you properly, ma'am.
Now, can you hear me?
We can hear you, but it is a little muffled, your sound.
Yeah.
It's
We
not
didn't
very
know
clear.
what now can you hear me now?
It's a little better, ma'am.
Yeah. That day we didn't know what the 40 units means, why he wants to take that, but he would say 40 unit injection de do humko. And that we used to go on, and then he said, now my father was not well, we must become a doctor so that we can take care of him. And there was a family doctor used to come every week. He used to give a long prescription treating chowkidar, talwas for everybody. And the man used to go to the shop, Doshi Medical, bring one jhola full of medicine, tonic, injection and all that every week. As a result, we had a big cupboard in our house. We didn't know what was there. It was like a big medical with no knowledge. And it was something which my mother said when we thought, once we become a doctor, first thing we'll do, get rid of this doctor because he doesn't know anything. And he's treating my father with congestive cardiac failure with tuberculosis. And
Oh
then,
my God.
yeah, and my brother who fell down in the sports, she had a thrombophlebitis, and she told my mother कि इसको अच्छी तरह से massage करवा दो पैर को. And as a result, his whole leg was swollen with fever, high fever and all that. And then I realized that uh, he needs to be turned out. But we couldn't say anything because my father said, तुमको मालूम है वो कितना पुराने से आते हैं? He's coming to our house for 40 years and you all don't respect. I said, Babuji, but he doesn't know anything. He's just eating wrong thing. He's treating you for tuberculosis when you're not eating. And then we came to know that he didn't have TB. He was in CCM because we called specialist home. And the specialist said, nahi sahab, isko to chest पर diagram करना पड़ेगा, ये करना पड़ेगा, and is in the failure. So that part was over, and this was the part of the family. And then on the other hand, you would like to know why we wanted to become a doctor. I think so. One of the reasons was my father, and secondly, my second sister. She was the most brilliant person in my house. She was a gold medalist from metric to MSc, then to her PhD. She did a PhD in Oxford. Then she was a Fulbright and Strathmore scholar and whatnot. And everybody praised her from top to bottom that she was the only person who should be respected. And we were again down. We said, "Arey Baba, arey science nahi lena hum log ko," because science mein jayenge like my sister, koi पूछेगा नहीं. We'll be just back again to our own this thing. So uh, we sat down together with my sister and said, देखो हम लोग क्या करेंगे अभी, ISC हो गया, 12th हो गया. So she said, fine arts. हमने कहा नहीं हम लोग डॉक्टर बनेंगे. She said, why? I said, डॉक्टर इसलिए बनेंगे because हम लोग का pedestal से ऊपर हो जाएंगे ना हम लोग. We will be somebody, they will think of us. अभी तो कोई पूछता भी नहीं है. Even the servants don't ask her anything. So as a result, she said, we'll become a doctor. Then one professor used to come to our house. His name, we kept, what name was H2S, because Hirennath Mukherjee was called. H2S, we'll talk to Mr. H2S and ask, is it better to do medicine? So he said, yes, tumlo doctor bana tumhare liye important hai. So this was the other thing, that she was the one who created that feeling of that we must study and become something and get prestigious person in the family, and not only in family but outside. She also created a feeling of learning science at home, and she created a club called Indian Science Circle, where there was junior section, senior section. Junior section, the children used to play, give lectures and small things, and the senior ones, they were used to have scientists from outside who would come and give lectures in science, different subject which we didn't understand. But anyway, we were not allowed there, but we were quite happy that we were giving a lecture on butterfly and thermometer and all that. And that was also very encouraging to learn science. And then we started liking science so much that we didn't want to take arts when we were told to take arts after passing was 12th. The idea of doing science was because in Calcutta those days, if you don't have science, you can't take medicine. That was something. So we had to do science subject. Thereafter,
Your experience at the Calcutta Medical College.
Yeah. Thereafter, we got started thinking about getting admitted in medical college, Calcutta Medical College. Again, there was a problem. The twin sister was not allowed to go in one college because there was a rule that two persons from the same family cannot be admitted in the same college. There was 4 medical colleges, but we wanted to be in the same college. So my father got very upset. He said, "मेरे दोनों बच्चों को एक साथ होना चाहिए." Finally, we got admitted in different colleges for first MBS. Then he said, went to be BC Roy, and he said, if she does well in the first MB, we'll put her in the medical college together. So that happened. We came to say second MBBS. I shifted, and again I was happy to be together. The thing was, Calcutta Medical College training was superb, absolutely superb. The teachers used to give devoted time to the students and make sure that the students who are really good and studious, they should get position in the university and become somebody top. And they used to be every 3 months exam. Uh, this was a sort of competitive exam, not necessary for everyone, but whoever wants to appear could appear, and there was always a gold medal along with it. So we did that because we wanted to upgrade our standard and know exactly how much we know and how well we'll do in the finals. So this thing went on till we went to final year. And the final year, there was a scholarship, Good Eve scholarship in Eden Hospital, where they had a special exam for that also. And I and my sister studied so hard, getting all the B's, the DCS, Dawn was there, unka special coaching, Guskas coaching and all that. But we didn't get through. That means we didn't pass to get first and second position. Two top boys who became seniors. So my sister said, Are, yeah, I don't want to do any more gynae. So it's why I studied so much, I would have become a senior surgeon in this hospital. So I said that, well, I have to do gynae because my father was very keen that one of the daughter must become obstetrician. So I had to take the line, please my father. So this is how we thought we will do. And thereafter, we passed, both of us finished the MBBS and did 1.5 years gynecology as internship. We had to do that, and also house job. There was a rule that you couldn't go to. We decided among us, ki, dekho, there's only 2 seats in medical college for MD, and we out of 120, 100 of us have passed in medical college. That was a something unique. Never in the life history such thing has happened. So my sister said, हमारा तो कोई chance ही नहीं है यहाँ पर. We must go abroad and we'll go to England. And as you said, it was a trend in Calcutta. जो pass करेगा MBBS must go abroad, must to get postgraduate. So 6 of us from my class, 2 of my sister and myself, and 4 other colleagues, we got together and we bought the ticket, got the visa and all that. And we went, we thought we'll go by ship because it was cheaper than airfare. So we took that. But I tell you, that was the most wonderful journey in life. In ship for 14 days, there was such luxuries all the time, eating, playing, running around, playing tennis, dancing. I tell you what a lovely time we had. And then there was a captain's cocktail. Captain cocktail, I thought there will be some khana pina, but I saw there was only drinks, nothing else but drinks. So I said, बड़ी मुश्किल. अभी तो we were told at home, अगर कोई बहुत force करेगा तो हम कहते ना कि I will take cider. I said cider माने apple juice. So fermented beverages. अरे बाबा रे, वो cider was horrible. You asked for cider and then say, have you got orange juice? I said, what do you mean by orange juice? Madam, you don't eat this orange juice and all that thing. Anyway, that was another experience we had, that drinks was supposed to be just part and parcel of the party and all that. And on the way in Mediterranean Sea, we stopped many ports, the Spanish ports and all, Egypt. And it was nice, me seeing different places on the way. It took 14 days to reach London. And we docked in London, Tilbury dock, we got down. And my younger brother was there to receive. He had come to do his BSc economics and then CA he wanted to do. So we stayed with him. And thereafter we proceeded to Leeds, where my brother-in-law was there, because the rule was that you couldn't apply or get a job unless you were registered with British Medical Council. So the question was कि पहले तो registered होना होगा, उसके लिए एक job करना पड़ेगा medicine में, and then surgery, and then you get full registration, then you can go for gynae obstetrics. So we started applying. It was bitterly cold in London, month of November, shivering. We were not used to that clothes, and we bought a coat, warm coat and cardigan, and so that we could keep ourselves warm. Sitting next to the fire, we started writing application, one after another, 20 applications a day through BMJ, and finally got a call. Then I was called for an interview, first interview in Kettering General Hospital as a for a house surgeon, and my sister got a job in Brighton General Hospital. So this is what here I learned the trick of, not trick, I would say the proper surgery. My boss was so funny, I would say he was so dead, sort of uh, interested in surgery, that he would start surgery at 1 in the afternoon, and it will continue till 8 o'clock in the evening. And here my poor thing, whole stomach was weeping for food all the time. And in the between, there used to be a little break where we used to get sandwiches and coffee. I said to resuscitate, because standing all the time. And he would talk all sorts of things in the while operating, what we have and what not in India, about India and all that. He said, "Rohatgi, may I ask you something?" I said, "Yes." "So, do you have polygamy in your country?" I said, "Polygamy?" I said, I don't understand what, you don't understand what is polygamy. You can anyway, that was it. And there was a really good session. And in the ward, there used to be, I was good in gynae because I'd done that 1.5 year in Eden Hospital. There was always a competition every day when there was a lump in abdomen, whether it is appendix or is it a gynae. And I would always find out whether it's, so when most of the time I used to win, and the prize was a bottle of beer. I knew that I'll never drink beer, but the bottle of beer was always, I was looking forward. They were, so I said, "ठीक है, जीत जाएंगे तो तुम लोग ले लेना, कोई बात नहीं." So this was also, and what I really like, the relationship between the bosses and the students and doctor. It was so friendly, which I never felt in. हम लोग जब in a hospital में, the bosses used to come, used to stand in a line like this, एक line से खड़े हैं, registrar सब कोई, and then एक जने जाके धीरे से boss का दरवाजा खोलेगा, he'll come out, and then he will go to his room. All that, and that sort of thing was not there. And I remember once we had to do this casualty duty, and this casualty duty, I had to phone my boss that one patient was admitted with retention of urine, 51-year-old patient. So he said, "What? You said 51? Oh, he's young. I'm also 55. I'm not old." I said, "You are not old, but that way." I said, "In my country, if anybody is 55, we consider to be old." In those days, people didn't survive more than 60. My father died so early. Everybody in the family died at about 50 or 55. So he laughed. He said, then I said, "Mr. Phyllis, sir, there's one patient admitted night." He said, "Rohatgi, don't call me sir, call me Mr. Phyllis." I said, "Yes, sir, I will not call you sir." It was very funny because so used to sir and madam all the time.
Wonderful.
Madam, also tell us about your standing ready with a pre-filled syringe of ergometrin to be given.
Yeah. And then after that surgery, I did medicine and I did my DOPSO exam. And my father passed away that. And then after I took an obstetric job with Miss Gladys Dodd. She was the pioneer person who had discovered insulin for control of PPH all over the world, sort of. So this lady was, by God, she was like a manly face with a dog on her, this thing, and she would get angry for little things. If any mistake in the obstetric department or unwanted death or something like that, or sad, or mother, she would. So once I was in obstetric duty, we had to stand. There was a rule that the houseman has to give intravenous ergometry for every patient who is admitted with the delivery of the head and anti-shoulder. So sometimes you have to stand with the filled syringe next to the patient till that patient delivered. And that was really torturous. Once one patient was, because most of the patients there were African, West Indians and African. And I was standing with this filled syringe. It was 2 in the early morning. And suddenly this patient was having rapid contractions every 2 to 3 minutes to 5 minutes, and suddenly she stopped. There was no contraction, and she started perspiring with cold hand feet, and I could feel the pulse. I ran and called my the senior registrar that this patient is not well. So he came and he applied Keelan forceps for unrotated head. There was a CPD. And this elderly patient, the baby came out as patient. Everybody took the baby and ran into another wound. And this was a spring door in the labor room, was locked, and I was left alone. The ergometer was still in the syringe. And here I was thinking that within 5 minutes, half bucket was full of blood. So I didn't know. I just changed, got a gloves, wore gloves, and put my finger in the vagina and started compressing, massaging the uterus to stop the bleeding. And I was praying, koi to aa jaye, koi to aa jaye, par koi aane ko taiyar nahi. Suddenly somebody walked in the student. I said, jaldi se bulao usko. Then the others came and we gave blood and all that thing. But this lady could survive. She died finally. And the postmortem was that she had a uterine rupture. They are extending laterally up to the fundus of the uterus. So that was one thing we learned कि elderly हो उसको कैसे देखना चाहिए, and the ergometry remain as it was there. We couldn't use it. I'm glad I didn't do it because वो जो already rupture हो तो और भी rupture हो जाता. Thanks God. And thereafter she made a rule all over the England that with anti-shoulder you have to, in a normal delivery you give intravenous ergometry. That's intravenous, not intramuscular. And with delivery of the head by forceps, you have to give injection ergometry in all primaries and fourth gravida onwards, not second and third. So this was something which stopped the number of PPH patient less, and number of deaths also reduced. And this was something which we all learned there, because although she was terrible woman, but she did something good to the nation and to the world, and especially in developing country like India and Africa, where there were a lot of deaths from this cup. And I had seen with my own eyes in medical college also, Calcutta, so many deaths from PPH. For no rhyme or reason, patient will come bleeding after delivery and bleeding. Nobody could do anything about it. So there it was. After that, after finishing my obstetric job, I was a deadbeat. I could hardly sleep for 2 minutes because whole night was standing next to the patient, seeing patient. And there was a galore of patients coming. All these African women never had any single husband. They had every day. They had, if you ask who is the father, they say, we don't know, maybe that the other chap who came at night. So that was the style of living, these West Indians. They would just go, anybody could come at home and they would be entertained, and this is the way they were entertained there. Thereafter, I decided that I will do my MRCOG exam, and I did a course in Queen Charlotte Hospital in Hammersmith, 3 months course to know exactly what to study. After studying this, we appeared for the MRCOG with doing a house job in Guy's Hospital, New Cross Hospital, which was attached to Guy's Hospital. And my boss was Mr. Tompkinson. And he said, Rohatgi, buy a book of Lewis, T.L.T. Lewis, and read and answer question and answer every day. You will show me 2 questions every day. If you want to pass, you have to learn this way. So I used to do that. And I think he was absolutely right, because he would correct my answers. And I knew that if I do that, I will pass. He said, I'll show you the colors once you pass the exam. And it was true. When I passed, he was the examiner also. And he said, I just phoned him when I came back home. Sir, how I did? Have I passed? He said, he wouldn't speak. He would just keep quiet. He said, who? I said, me, Dr. Rohatgi. So he said, nahi, nothing. I said, oh, forget about it. You have passed. Oh, what I was so happy, because next day we were going to Europe for a little holiday, and it all made the day, because that happiness I could never think of it. Because at night my brother came in a some second 1930 की गाड़ी में एक रोज लेके आया दिखाने के लिए कि तुमने पास कर लिया. तो it was really very nice to see all that to somebody there, and that was made the holiday good. And then after passing, we decided I did the registrar job for 3 years, and I thought that it was important. Everybody said, now you have not come even once to India. We never got a chance to go back to India. So after 7 years, we thought I must go back to India, and I wanted to be with the family and also teach. My main thing was I wanted to teach everybody who will work and with me what I have learned, so that they need not come to England. It is not necessary to come to England. It is important to learn the technique and the way they look after the patient, that they take, how they are managed there. We will do the same thing there in India. So I came back, and my husband has already come back. He was not husband then. Then he said, जल्दी जल्दी शादी की तैयारी करो. मैंने कहा नहीं बाबा, अभी अपने पेरेंट्स को बताना पड़ेगा ना कि I want to get married to you and all that. And then I told my mother, great discussion at home. I said, mother crying with tears. He said, नहीं नहीं ऐसे ही होता है, लोग क्या कहेंगे. उसको विरायत भेज दिया और उसने लेके वापस शादी. हमने कहा मम्मी अगर हमको सच में शादी करना था, I would have got married in England. Why here? But I wanted to be with you, and since I promised I'll not do anything which will take away the family name, so I would like to take permission and like to get married by you and everybody at home. So my brother said, Mummy, stop crying. We'll arrange for the wedding for her. And it was very nice. And I got married and I came to Nagpur. And there was the story that Nagpur was so dry. The Satabaldi road was in 1967, only 5 feet wide. With the dhool, dhakkad and lalu chali, and then one side Maharaj Bagh, the tiger roaring in the daytime. And the evening, from Morris College, these jackals will come. Wah, wah. And it was, I said, kaun se jackal mein aa gaye baith? And at night, there were no patients in the hospital. So hospital was to close down. My husband said, तुमको OPD में जाना है? मैंने कहा हाँ, क्या 7 पेशेंट है, तुमको जाना तो देख लो जा. मैंने कहा हमको नहीं जाना है. Anyway, with 7 patients, we started going. At night, I would run through the long corridor with 0-watt bulb and go and see the patient and come back. And I said, I will go रो इतनी बार साड़ी नाइटी बदलनी पड़ती है. I'll wear my white coat and go. नहीं ये इंडिया है. You must wear a sari properly and dress like an Indian girl and go and not go like that. I say बाबर है, मुश्किल ही कर दी तुमने हमारी. And then of course he said, जब हो गया बच्चे बोलेगे मुर्गा है कि मुर्गी है. मैंने कहा क्या मुर्गा की मुर्गी. Tell me whether it is boy or girl. And I didn't know Marathi that time, so to understand Mulga and Mulgi was also too much. Anyway, that was the period which was just owning the place. It was in a ramshackle place. The hospital was broken, the walls were breaking off. There was hardly any operation theatre proper. There was no autoclave, the instruments were all damaged. So I thought that we will do up this hospital. And my husband was then appointed as a medical superintendent. And we both started working with 2 doctors and 2 nurses. And we worked day and night and got everything changed. I used my instrument, which I brought from England. I said, let us start doing something with this. In the meantime, we found there were many doctors who had returned from England doing FRCS and this and that. And they were looking for a job. And they said, he asked, तुम हमारे यहाँ काम करोगे? 50 रुपए महीना देंगे. So he said, हाँ 50, हाँ sir, we'll do. We have to work. At least कहीं तो छुरी चला दे. So that was it. So I remember there was one doctor surgeon, Dr. Harish Nerula, and he said he was operating on a Sardarji with a hydrocele. And those days they used to be open ether anesthesia. Dr. Harvey used to give mask, और लगाया 2 chapat लगाई out the patient. That was a way to anesthetize. So she had done this healthy man with open ether, and this man was not completely out. So उसने जैसे उन्होंने उनको autotomy position में रखा, and he was put a knife. This fellow got away, get a one slap, and
Oh my God.
they got him a black eye. And some समझे भूत आए, सबके सब भागे. All ran out of the theater, and here Dr. Rula holding a knife, and that boy holding him tightly like. It was a real picture. We see it. Okay, भूत ऐसा. Can't forget that scene. We also ran to find out what has happened. Anyway, this was then we said nothing doing, no open ether business. We must have a proper anesthetist to anesthetize and no spinal anesthesia also. Because for all season we had to give spinal. I also learned many. I gave many spinal. I said, I'm not going. If the patient मर जाएगा तो मेरी जान निकल जाएगी. वो सब होने के बाद slowly the hospital started doing well. Then he said we must departmentalize the hospital, and we had all different obstetric, gynae, ENT, surgery and all that. And we had 10 house surgeons and 10 consultants in different departments. So that made the day, and that's how the Memorial Hospital said. Then because I was getting as a chief consultant 400 rupees per month. That was also too much. And I said, बाबा घर नहीं चला सकते 400 रुपए में और तुम्हें मिलता है 1000, कैसे चलेगा? तुम इतने जने को घर में बुलाते हो, it's not possible. So I said, I must do private practice. Not that I wanted to, but I resigned after 3 years and started my practice outside to a little bit more money for the house. And then opened my clinic hospital in Jasleen, and then constructed my hospital, shifted there. The reason for shifting and building a hospital was that I wanted to introduce, I was very much interested in fertility practice, and I wanted to introduce a newer technology and skill to the generation of gynecologists who has come, who had not seen this type of surgery, a minimal invasive surgery, which was something which was unique in those days, because I had heard a lecture of Professor Sem in 1918 in Hotel Taj in Bombay, and he showed so beautiful videos of these different surgical skills doing this ectopic, so something all in fertility patients. And so I asked him if I could come to Germany and learn the skill and all that. He said, yes, yes, you write to me, I'll arrange for it. So first thing I did was to become a member of IIG in Bombay and took a course, 10 days course. And here Dr. Nalini Torne was with me, and we both of us went to Bombay. We did this course. I was in Kama Hospital, and we used to do theory in KEM. Returning, we decided both of us will do quietly. जब हम करेंगे तो तुम हमें बुलाना, और तुम जब करोगे हमें बुलाना. But she said, वो कभी नहीं बुलाती. Only I used to go and calling her. I said, "Ma, you never call me. I only call you for." She said, देखो ट्रोकर और कोयलर डालने में मेरे को बहुत डर लगता है. तो मैंने कहा मेरे को क्या नहीं डर लगता है, कहीं उस इंटरेस्टिंग में और कुछ इंटरफियर में ना कहीं वो कुछ पंक्चर हो जाए तो क्या होगा. कहती है अच्छा तो हम लोग अच्छा इंसफलेशन करेंगे. So we didn't have gadget for insufflation much. We used to use the fish tank insufflator, and prior to that sigmoidoscopic bulb. तो उसे एक जने पंप करके inflate करता है, उसके बाद put the trocar in Kerala, somehow see the tube somewhere, and because always thought ready for opening abdomen, always in case kuch ho gaya, we'll open the abdomen, do the surgery. So I remember that once we thought that we have punctured the intestine. So we immediately opened the abdomen, and that woman got very annoyed. She said, आपने कहा था कि आपका कुछ नहीं होगा, 2 दिन में आप घर चले जाएंगे और आपने तो पेट काट दिया. तो हमने कहा बाबा हम लोग को ऐसा लगा कि कुछ इंजरी हो गई है. उसके बाद that after that I got joined Daga Memorial Hospital in 71 as a consultant, honorary consultant there, and there was one tubectomy camp going on. There were 3 tables. There was 2 were doing open surgery and 1 was the endoscopic surgery. So I was endoscopic surgery table, and this lady was ऐसे थे, अब कौन सा ऑपरेशन करेंगे. हमने कहा वो दूरबीन का. हाँ दूरबीन का, मैं भाले वाला. हमने कहा भाले वाले मने किया, हाँ भाले से आप छेद करेंगे. मैंने कहा नहीं भाले से. So he said why? I said why? He said the reason is कि अगर आपने भाले से ऑपरेशन किया तो आप कल घर भेज देंगे, पर अगर आपने ओपन किया 5 टाके का ऑपरेशन करेंगे तो आई विल एटलीस्ट मैं 7 दिन आराम करूंगी यहाँ पे बिस्तर पे लेटे, क्योंकि घर भेजने के बाद मेरे को आराम करने का मौका नहीं मिलेगा. So I said why? He said yes, ये घर वाले तो आपको कहेंगे आप आज कल करके भेज देंगे घर से, हम क्या करेंगे, घर में आराम कैसे करेंगे, इतना बड़ा ऑपरेशन कराया हमने. So I said अच्छा आप हमको हम आई विल मेक श्योर कि तुम 5 दिन रहोगे यहाँ पर, तुमको अभी थोड़ा खून कम है इसलिए तुमको इंजेक्शन देना पड़ेगा. So she stayed back, but the thing was कि people used to think कि tubectomy if it is done through this thing, and then at the same time she said अब तो इतना आवाज हो रहा है, आपने जरूर भाले का ऑपरेशन नहीं करा है, ओपन देख नहीं रहे पर से हवा चल रही है. Exhaust fan was moving. I thought some machine was moving inside her abdomen.
भट्टाचार्य मैडम को भी ऐसे सब एक्सपीरियंसेस आए होंगे मैडम. Once you were a teacher, you started private practice.
You are absolutely correct. Anyway, the Daga was over. Then I came to my own hospital. And
Bhattacharya madam, are you there?
Yeah, she was there.
Yeah, she must have also faced the same thing.
Yeah, she must have also faced some similar situations. She has also visited abroad, visited so many centers abroad. So I also wanted to know her.
So coming back to my own
शायद उनका फिर से freeze हुआ है, वो आएगी फिर से login होगी शायद.
Yeah. So that is thereafter I came to my own hospital and started endoscopic this thing center for a minimal invasive surgery, and that was the time 1982, and that was the time when we started teaching all those who worked under me to assist, because that was told by my boss, Rohatgi, if you want to learn anything, assist and learn the technique. Don't look into somebody's uh, picture or video and do, because you may make a mistake. But when you assist, you learn more than anything else. So there it was, and that's how it went on and on and on. And then in 1990, I was elected as the president of NOGS, and 1990 years. And that was something new which I had never done before. And I said, now this is the time when I have entered academic field, and I was becoming coming in touch with people who were all the doctors in medical college and all that. And the All India conference was there, 34th All India conference. Foxy was there in Nagpur, and first time. So we had to make sure that should be excellent, because ऐसे chance kabhi nahi milega, and people must know that Nagpurian girls and doctors are also extremely good. So we got team from medical college, सब अच्छा उन्होंने बनाया सब कुछ, and we had a very nice conference. Dr. Shri Seth was installed as a president of Foxy that time. So there it was. Thereafter, things, academic field went on, and I've got to say that thing that organized many for conferences, wrote papers, and there it is. Now I'm here now. Thank
Madam, you have been a fitness enthusiast also, and you have been pursuing your exercises till date, even after your knee replacement surgery. So
Yes.
you also had many hobbies like dancing, ikebana, flower arrangements, playing the sitar, gymming very regularly. So what is your fitness mantra?
I think what is most important, that we must do exercise. We don't do exercise because we are busy with our own work, and we don't do any exercise. And this is the month of fitness. I thought after that surgery for my knee joint, and before that also, I'd been to Bangla Deshpande, and she said, I said कि मेरा घुटने का दर्द बहुत ज़्यादा है, can't walk 10 feet. Said, you want to know something? I said yes. Said, you will never be all right. I said, how dare you say no? मेरी फीस वापस करिए, आपको मैंने 500 रुपए दिए थे. So she said, I said, yeah, I know she said right thing, but I went on working and working till I got myself operated. And I must say that if, as we grow old, if we have an injury to the knee in our childhood, one must understand that later in life you can have these knee joint problem. I had a big fall on my knee 2 or 3 times, and that's what increased the caused the osteoarthritis and pain and all that thing. So, and then in the childhood also, we were very good. I was very good in sports, always getting prizes, and learned dancing from very childhood. It was a rule in Bengal. हर एक लड़की को 3 चीज आनी चाहिए, गाना गाना डांस करना और खाना बनाना और लंबे बाल. ये नहीं होगा तो उसका शादी नहीं होगा. That's important. So we had to, my parents said, dance school जाना पड़ेगा तुमको there. Then we had a teacher at home who used to come and teach us dance, and there was also music teacher. Then we learned sitar as in medical college. And when we went to England, we did a program with in Queen's birthday. Me and my sister, both of us did a dance there also. And that was also very enterprising, because I thought we had forgotten, but we didn't forget. We were very enthusiastic to do something Indian and show them also. So that was it. And as far as flower arrangement was concerned, there's one lady called Mrs. Antanarayanan. She was a lady to be appraised, because she used to teach ikebana and other flower arrangement, but never asked कि तुम rose लेके आना, कि वो फूल लेके आना. She said, just bring a branch of a tree or something, and I'll tell you how to arrange. And she would cut in such a way that at the end, when you put it in your drawing room, it looked like a real tree or very beautiful thing. And that's what I learned the art in 10 days. I used to go in the afternoon, because I said morning, evening नहीं होगा. कहते afternoon में आ जाओ तुम. तो हम afternoon चले जाते थे. And that's how I was always very keen to learn flower arrangement and all that. And so.
Ankita, to unmute. Ankita, unmute kar. Ankita, unmute. Bhattacharya madam has
Dr. Bhattacharya madam now again with us, connected. Madam, yes. As Rohatgi madam also went abroad and learned so much abroad, you were also invited to the USA at various centers. Then you also visited Germany.
Hello.
To update your surgical skills in endoscopy.
Hello.
Hello, ma'am.
Yes, ma'am, we can hear you.
Hello.
Yes, yes, we can hear you. Nandita madam. Hello.
Me? किससे बात करें?
ये freeze हो
I
गया
think फिर से
शायद.
गया उनका network.
Hello.
हाँ madam.
Hello.
Madam, you're here. We can hear you, ma'am, now. So, madam, you have also been abroad to various centers and you visited Germany to update your surgical skills in endoscopy. So, how was your experience during your visits abroad? Did you observe any difference in the working pattern there and in India?
Actually, I don't know, because Germany people could do laparoscopic hysterectomy very well. That was beautiful, and of course learn something, but the efficiency the Indian people have got, I don't see abroad. I am proud of my people here who can learn things in a very short period and in a very beautiful manner. But in the Germany, Dr. Mettler was there, Mrs. Mettler. She used to like me like anything. Look, she was younger to me, 4 years younger to me. But then she used to admire me. At this age also, I wanted to learn something. And in USA, I didn't enjoy much because their way of treating, investigating, it was very different than what we have here. So that was my experience. But we are the one who are really very experienced, learn things very quickly, and without much of your instruments, we can do things much better than what they do.
Yes, totally agree with you. We Indian doctors are really, really
Really
much
good.
ahead in surgical skills and we do
Yes,
really well.
correct.
Another thing, madam, after being a medical teacher, you started private practice. How did you find the change from a medical teacher, a teacher at a professor at a medical college, and then starting private practice at a later age?
I did really love practice because there you can do one-to-one consultation, follow them up properly, and they know that this doctor is quite faithful and will do whatever good for them. I really love private practice. I have learned things from medical college, but then it is utilized in private practice.
Right.
Yes, definitely, ma'am.
Uh,
And private practice, as everybody knows, is not a bed of roses.
no,
There will be many stressful situations and moments. Any case which was particularly difficult to be managed or very memorable that you would wish to share with us?
I don't think so. Because when once I know that this patient I cannot deal with, I used to send them to proper place. So I never had any difficulty.
So you believe prevention and taking care in advance
Oh yes, agreed, 100%. Prevention
and
is better
something
than
that you cannot deal with has to be sent away to some other specialist or to a higher center. That
no.
was your way of approaching
Medical college.
medical college.
Not higher center. It is to the medical college only. Medical college, Daga Hospital. As she told me, no, Sindhu, that I have sent many patients to her hospital because they cannot afford expenditure, and of course the proper facilities were not there with me.
You are a woman of principles, whether it is at work or at home. I was talking to Nandita madam also, and she has been talking a lot about it. There are many hurdles which normally come during this journey of life. What is your mantra for a successful, happy, and life of content?
See, you should be satisfied whatever you do, whatever you get, and should be happy what a little you have got and little success that you have got. Trying to get more is really bad.
Yes, madam. Those are golden words for all of us here listening to you. Yes, one needs to be satisfied and happy with whatever one has. And of course, one should strive for more, working harder in your individual field and in your own work. But you have to be satisfied and happy with whatever success you get.
That's right.
Any advice for our present generation doctors, madam?
Doctors should be very friendly, polite, should recognize the pain that the patient, we will not be a very good doctor. Very sensitive, gentle, kind, caring, then only she can be a good doctor.
Yes, ma'am. Definitely, I guess all the doctors who are listening to you, the younger generation especially, will try to inculcate these qualities of, and then of course they are good doctors, but they even become better after they inculcate these qualities, as you mentioned. Thank you so much, Madam Bhattacharya, madam.
Thank you.
And thank you, Rohatgi, ma'am. What would be, you have been a laparoscopic surgeon, a pioneer among the laparoscopic gynec laparoscopists in the region. And laparoscopy was a very new subspecialty in gynecology in those days. And you have traveled so many places to learn the science and art of laparoscopy. What would be your advice to young generation OBGYs wanting to pursue laparoscopy as a subspecialty? Rohatgi, ma'am.
I think the
And
first,
of course, Bhattacharya madam also, I would want her input
yeah,
in that.
first and foremost, as whatever Dr. Bhattacharya said is correct, that how the doctor should be, should have patience, should counsel, should be gentle, and so that the patient develops confidence in you, that you are the right person, where you are the person who's going to treat and make them all right. Because this part of the treatment is very, very important. That is counseling before doing any treatment you want to do, because for them endoscopy means nothing. But most of the patients used to come to me were uh, infertility patient, and they were always harassed by the parents or the in-laws for not having a child. And they were mostly the patient with endometriosis, blocked tubes, or with ovarian problems. And the thing in those days I saw was कि wherever they went, 5 महीने तक fertile चल रहा है तो चल रहा है, and thereafter छुट्टी, और they do ovulation study 2-3 बार, and then say बाबा तुम्हारा कुछ नहीं होने का, तुम कहीं और जाओ. So the question was कि investigation was never done properly, and I said for a good successful management, first and foremost the first tool should be you have to be a good clinician, so that you make diagnosis, provisional diagnosis. On the basis of that, you do investigation to see whether your diagnosis, how much it matches. And then after you decide what type of treatment you would do, whether the patient needs a medical treatment or whether the patient needs surgical treatment. Everybody doesn't need laparoscopy just because she has come to visit her. There may be something else, maybe something wrong with the husband, or something which the one patient came from Chandrapur, and when I saw her, she was crying and crying. I said, I don't know क्या हो गया इसको. उसकी daughter, sister-in-law had brought her here. So she said, इसको 20 साल हो गए. बहुत धीरे से कहा, her husband has never touched her. I said, why? तो कैसे उसका बच्चा कहाँ से होगा जब the husband hasn't touched her? So I said कि पहले तो वो करो, तब तो उसका बच्चा होगा, कहाँ से हो सकता है? So I examined her, and then she had a sort of hymen was hardly torn, nothing. I don't think she ever been together. And then I did the hymenectomy, and after that she conceived. The question was कि very often the woman doesn't know what to say, and this man was wanting to get married. So this was one case. Another case was uh, one of the patient who had blocked tube following tubectomy, another with the a femoral block or something like that, something which needed surgery. So I thought that she needed open surgery or endoscopic surgery, where one can do use a microsurgical skill and do end-to-end anastomosis and cut that tube or join something. So I called my sister-in-law from Calcutta. She is a microsurgeon and also cosmetic surgeon, very good plastic surgeon. Maybe you might be knowing it, Dr. Sheila Rohatgi. And my bhabi, she came and she operated on these 3 patients. One had 2 girls, so they wanted a boy, but she had got it herself, tubectomy done, and they wanted to open. The other one was this married to a man who was a big rich farmer and sister of a very leading doctor, and she said कि अभी इसको बच्चे नहीं होगा तो इसको हम डिवोर्स कर देंगे और दूसरी शादी करेंगे. They were really worried and they said, डॉक्टर साहब कुछ तो करिए इनका. So he operated on that. She had also some obstruction for which she needed uh, microsurgically treats, and we had a microscope that time, and we could use that microscope for doing this microsurgery. And there was another patient who was also similar type. What I mean to say that you have to choose the right type of surgery for right kind of patient. You can't go on doing laparoscopy and somebody is already with blocked tubes with due to tubectomy. How can you open it? It's not possible. Nowadays, of course, the techniques people are doing laparoscopically, tubal anastomosis and something, but those days it was not the thing which could be done. And then again, I would say that any technique you do, you must go for full training. Don't start doing it in your own nursing home without training, because you may end up in such a way that you may not come out of it. And that's something which ruin your whole career. If one case goes wrong, if you think you can't do it, get somebody who's expert and tell him to operate and assist. That's also another good way of doing it. And see how he has managed.
Thank you for watching.
Yeah, what does Bhattacharya madam have to say about this? What is her opinion? Ma'am, what is your opinion, Bhattacharya ma'am?
About what?
About laparoscopy or
Oh,
the people who want
laparoscopy. Laparoscopy is only for, at least I feel, diagnostics.
your
Because
voice.
of course I haven't got that efficiency in doing further, but I feel laparoscopy, especially to diagnose, the undiagnosed this endometriosis. That is very important because that can be seen in the pouch of Douglas spots, and that must be the cause of infertility because rest of the factors are absolutely normal. So really, and what she said, I agree with her, Dr. Grohodgi, that we don't take their personal history properly, whether they had contact or whether they live together, that is very important in sterility. If you understand their proper problem, the sterility becomes very easy to treat. That is what I feel.
So with this, I come to the end of this session with both stalwarts from
Yes,
our own
I like to speak in one incident. I was in Mirma, just joined, and there was one chap, farmer, came with his wife, was treating for infertility, and I said, cement test karna padega. That was done, and he was azoospermic. So I said, you see, I can't treat you. You have to see somebody else about it. So he said, नहीं नहीं आप तो गायनोकोलॉजिस्ट नहीं आए हैं, आप तो कर सकते. मैंने कहा नहीं, हमने ये ट्रीटमेंट नहीं करते. After 4 months he came, she was pregnant. I said, आपने क्या कहा था, कभी नहीं हो सकता प्रेग्नेंट. भगवान ने दिया होगा आपको. I don't know. ऐसे कहीं मंदिर तो नहीं गए थे कि पंडित जी ने दान दे दिया होगा.
अभी हम लोग लॉग आउट हो रहे हैं.
So
नंदिता मैम
मैडम का फिर से फ्रीज हो गया है.
फ्रीज हो गया. Actually, we wanted Nandita ma'am also to give some inputs. She had very interesting stories about. Yeah, she's there. Nandita ma'am.
Nandita madam, are you around? Can you hear?
उनके network issues आ रहे हैं बहुत. They actually locked out.
She's locked out. So in fact, I would like to share my screen and show some wonderful photographs of. Just share my screen.
I just happened to see those pictures and both of them look so beautiful.
Yes.
Yeah, Nandita ma'am is there.
Yes.
Till then, Nandita ma'am, can you share? Yeah. Okay.
I am here. Both our stalwarts is here on this screen. These are their latest photographs. So for every one of us to view. Yeah, this is Bhattacharya madam in her younger days. Very beautiful.
Absolutely beautiful.
Very pretty. Very pretty.
Very pretty. And here is Bhattacharya madam with her family. These are some old pictures which Nandita madam shared with me. They were a big family, brothers, sisters. This is after surgery, right, Nandita madam? After madam surgery? Is
नंदा मैम
Nandita
अनम्यूट कर लीजिए, अनम्यूट कर लीजिए.
And this is after her stenting in Uday Mahurkar's clinic on the second day of her stenting.
So this was how long back, ma'am? Nandita madam, how long back was this surgery?
I think they are facing a lot of network issues.
Yeah. These are some of the professional excellence awards which madam has received. This was from the Academy of Medical Sciences, Nagpur. This is at Doctor's Day when Madam Bhattacharya was felicitated in July 2015. Yes, this is one picture which I just loved. It's so close to my heart. Cooking.
So beautiful, really.
And Madam cooking, sitting down, cooking very systematically. Everything have been placed. I can see she was cooking soya chunks the other day.
At this time, no one can enter. This is that no entry zone.
So your kitchen is still the
No,
same,
it
ma'am?
has to be very clean and neat.
Very clean.
It's wonderful to see Madam cooking at this age, and I happened to see that she was cooking soya chunks, one of my favorite.
Even we are focusing on what's being cooked.
There was milk boiling away, and then there is soya chunks being cooked, and some cauliflower also, I guess, being cooked. This is her garden, which she loves, the green niche, which she has been taking care of. Bhattacharya
Very
madam.
nice.
Loves gardening, loves stitching. She loves taking care of the plants. She loves to keep doing her things all the time without stopping. Age doesn't deter her from stopping. Same is with ROHATGI madam. Age doesn't deter her. So this is the AICOG picture, AICOG 1990, which was held at Nagpur, where the convocation NOGS was declared to be the best society. Madam ROHATGI and Vaze madam receiving the award.
Wonderful.
Madam receiving the best paper award at the same time for her paper on NST is the tool in high-risk pregnancies. Madam being conferred with the Lifetime Achievement Award at this conference for her 50 years in service of women and child health in Nagpur, Vidarbha, India. This is her old cutting when she took over as president of NOGS in 1989. Yes, this picture is wonderful, madam. I insisted that madam should send some pictures of her gym and she working out with her trainer. This is her birthday celebrations at the gym with Dr. Ketkar madam. Yeah, her dance performances.
Wow.
Very, very pretty. My God, this picture I'm in love with totally.
I mean, really, some Bollywood heroines here.
Yeah.
those days, step puffed up, kudi juda banana padta hai, back comb kar kar.
Beautiful, ma'am. Who's this? Who's with you in this picture, ma'am?
My sister, twin sister.
Oh, both of you so beautiful.
Was she a doctor, madam? Your sister?
Yeah, she was a pediatric surgeon and professor in All India Institute of Medical Sciences. And she was also in Guinness Book of for devising many pediatric surgery. This for hydrocephalus, tracheobronchial fistula, then hypopedias. All that one-stage surgery she has devised, which everybody follows even now. Unfortunately, she passed away in train accident when she was going to Calcutta to receive the felicitation.
Oh my God. But this is an amazing, amazing picture, madam. This should be framed.
Really?
Such a picture.
Picture perfect.
And this is madam at the convocation, RCOG convocation at.
मैम आप कहाँ डॉक्टर बन गए? आपने तो फिल्मों में जाना चाहिए था. So beautiful.
Really very nice pictures. This is her Christmas celebrations at the Hope Hospital in 1969. Celebration with the nursing staff. And there is Madam in her sari.
People used to love the sari. I tell you, that colorful Indian sari, they could appreciate for hours together. So I never stopped. I never wore Western clothes. I always used to wear sari from the beginning till the end. And I think I'm happy that I continued that way. Yeah.
Saris do look amazing on you, ma'am. And this is Madam meeting Indira Gandhi.
This is 1981. We had a conference in, sorry, not 91. There was a conference in Delhi, All India Conference, Gynecological Conference. And then we went to Indira Gandhi's house. She had invited us for tea. This is how we were sitting there in her garden.
This is meeting Vice President at the same time.
Zakir Hussain. That's right, Zakir Hussain. And this is my sister, older sister, who's in Toronto. And she is also a professor in physiology. Now
that's wonderful, wonderful sharing, madam. And this is sir and madam. This is such a lovely picture.
Oh my God, such a beautiful pair you all both made. My God, sir is so handsome. Yeah. Who's this? Who's the other lady in picture?
This was one Dr. Wilson. She was also working as a houseman in Muir They could tuta puta behind.
This is what Muir Hospital?
Yeah, Muir Hospital.
Oh, baapre.
This was the condition that time when we came.
My God. Handsome.
This is at Muir Memorial. All the consultants at Muir Memorial Hospital.
Lovely.
This is Madam at her convocation for the FRCOG. 1983. I think this is the last picture that I have.
Thank you.
Wow. Nandita ma'am, you are still there. Nandita ma'am, can you unmute?
Yes.
If you can start your video, we want to see. Yeah.
We want to see you and talk to you also.
Yeah.
आपकी भी कुछ memory share कीजिए with NOGS with.
कहाँ चले गए फिर से?
No, I'm there. Yeah, I have got a beautiful memory with Dr. ROHATGI madam.
Yeah.
Walking on the ram. My partner. That's a very, very beautiful memory.
मैम आपका तो मैम की तो मेमोरी शेयर कीजिए बट आपने मुझे फोन पे बहुत सारी चीजें बताई थी भट्टाचार्य मैम के बारे में कि अभी भी वो कितनी उनकी मेमोरी शार्प है उनके स्किल्स अभी भी कितने वो थोड़ा बताइए ना हमको
वो तो अभी भी है बहुत स्किल उसके लिए तो आपको आके उनको असिस्ट करना पड़ेगा तब आपको समझेगा व्हाट शी इज रियली स्टिल you know few days back only we have operated on an ovarian tumor very big 20 week size and that was so much adherent malignant ovarian tumor 51 years old this lady got absolutely all right and then the chemo was started on her and then she had during chemotherapy after say about 4 weeks or so she had this fistula small fistula and she said no it can't be my this thing it is definitely from chemotherapy and it was really proved that it was from chemotherapy like she's very confident about everything like many a times I used to say my goodness I don't know why this patient is not passing musha and I must have left something and she used to say no I was there I have checked all the swabs and needles and sharps and everything so it can't be anything like that she's very confident on anything and today also whenever I'm keeping any patient for operation I always consult her I will never I never did any operation without consulting her.
Amazing.
Yeah.
It's just amazing to hear from both of our stalwarts here.
Yeah.
Legends, living legends, as they should be rightly addressed. And thank you, Vedai, for giving this opportunity. And it was wonderful talking to both Rohatgi madam and Bhattacharya madam,
Yeah.
and being here with all of you today.
Thank you everyone. Bye.
Really a wonderful session today. Really overwhelming to hear all those stories. Really heartening, मैम. इतना मजा आता है वो सब पुरानी बातें सुनने के लिए. बहुत बहुत अच्छा लगता है. And we feel so proud, और ऐसे हमको इतना खुशी भी होता है कि ऐसे seniors हैं हमारे NOGS में जी. So it really swells our chest with pride. Really, thank you so much for today's session, Rohatgi ma'am, Bhattacharya madam, and Nandita ma'am for coaxing ma'am to agree to our demands.
Yes.
मैं उनको सुनना ही पड़ेगा, ऐसे कैसे वो ना बोलती है, उनको आना पड़ेगा, मैं उनको बोलूंगी.
She's so tired, no? She's gone off to sleep.
Oh.
Okay, bye.
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 Thank you so much.
Bye.
Thank you so much.
Ankita, thanks to you, yaar. Going on.
Thank you, Ankita, for you have taken lot of pain.
Yes, lots of pain. It takes a
The
lot of
pleasure
efforts
is all
to-
mine. The pleasure is all mine. Thank you.
Okay, bye.
Bye.
Bye. Yeah, Rajasi.
Thank
Yes,
you. very
ma'am.
much.
Yeah, over to you.
Yeah, thank you, ma'am. My God, I have actually no words to speak. These two towering personalities have completely left us spellbound today. For once, I'm short of words कि उनका कैसे शुक्रिया अदा करूं. Really, both of you, Prabha ma'am and Manjula ma'am, Rohatgi ma'am, thank you so much. Your words have been completely overflowing with wisdom. The way you both have tracked your life journeys through light from childhood, early days till today, the way in which you have carried out yourself as a persona, as a doctor, and managed to handle your career so nicely all through these days, all through these years, and the messages that you both have given us to the future generations. I think each and every part of it, each and every word of it is like a precious treasure. We are really thankful for both of you to be here today on this session and guide us and give us all the rich experiences you have had in your life. We wish you both a very long, happy, and healthy life ahead also. I must thank our past president, Dr. Ankita Kothe ma'am, for painstakingly compiling these two interviews and making it so interesting, so interactive. The pictures and photographs that you shared, madam, they were simply amazing. So
Yes,
thank you
I
so
must
much.
thank both of them, both Rohatgi madam and Bhattacharya madam, for sharing all those lovely pictures with us. And
Yes, definitely.
they'll be a treasure for all of us for years to come.
Yes, definitely. Thank you so much, everybody. Yamini, so much thanks to you for conducting the ceremony so nicely. And of course, all of those seniors and all of those respected doctors who have joined in here to listen to this session today. Thank you so much, everybody. It's because of you that we have the energy to keep going week after week, CME after CME, and event after event. So please be with us the same way, keep guiding us, giving us your feedback, and keep loving us. With that, I would like to sign out today. Thank you so much and wish you all a very good evening. Bye-bye.
Thank you very much. Thank you.
Thank you. बड़ा मजा आया आज यार, बहुत मजा आया. रोहतगी मैम, क्या मेमोरीज है आप लोगों की, ऐसे हमको मतलब स्टन हो जाते सुन सुन के क्या क्या हुआ है. अमेजिंग रियली. और उस जमाने में मैं कैलकुलेट कर रही थी 14 डेज आपको लंदन जाने के लिए लगे, मतलब ऑलमोस्ट क्लोज टू 336 है, मैंने कुछ कैलकुलेट किया आवर्स, सो मेनी आवर्स, एंड नाउ वी रीच इन 8 to 9 आवर्स लंदन, और आप 300 मतलब ऑलमोस्ट एक साल में 365 डेज, 330-40 डेज होते हैं, मतलब 14 डेज में आवर्स होते हैं. इतना चेंज. एंड दोस डेज आप लोग लड़कियां अकेले गई, अकेले आप लोग रहे, कितने गट्स है ये करने के लिए. अमेजिंग, सही में नो वर्ड्स रियली. बहुत मजा आया. All our these 4 sessions have been truly outstanding, Deva. And we are so glad we are able to put, bring this in front and in front of everyone, isn't it?
Yes, it's absolutely a.
So तू सूत्रधार है ना उस पूरे इसकी, इतना अच्छे से सबका सामने लेके आ रही है. So big credit goes to you also.
Thank you for giving me the opportunity.
और आज तो तेरा वर्चुअल बैकग्राउंड तो एकदम खासी है एकदम. मस्त दिख रहा है, देखती भेजती देखो फोटोज. अरे यामिनी, यू आर नॉट अनम्यूटेड, मैं तो को कोहोस्ट बना के रखा था. ओके, देख, स्टार्ट योर वीडियो, यू आर अनम्यूटेड. You were the co-host.
Hello, ma'am. Yeah, ma'am. It went in the middle, I think.
Okay.
Superb session, ma'am. Ankita, ma'am, really amazing. Rohatgi, ma'am, I don't know if she's there still.
Yeah, Rohatgi ma'am is there.
Rohatgi ma'am is here.
Ma'am,
Bhattacharya
such
madam
beautiful
is there.
memories, so inspiring and so nice to hear all of it. Really very nice, ma'am. Thank you.
Sir,
Yes,
beautiful
very happy
pictures,
today.
ma'am. Really, आपने सही में आप पिक्चर मूवीज वगैरह में क्यों नहीं गए एक्टिंग करने? कितना like a literally बॉलीवुड
Literally,
हीरोइंस को आप
so
बीट कर देते थे
beautiful.
उस टाइम की.
वो सब
Yeah.
फेल है, शर्मिला टैगोर and
Yeah.
all the Nargis and
उनकी
शर्मिला
छुट्टी कर
टैगोर
देते थे आप, बाप रे. इवन भट्टाचार्य मैम की वो पहला पुराना पिक्चर, माय गॉड,
amazing.
so beautiful. वाओ. अभी आप इतने ग्रेसफुल, इतने मस्त दिखते हो, बट उस टाइम का वो एक अलग लुक आज दिखा हमको.
True bong beauties, both of them.
True bong beauties.
True bong beauties.
Really.
मजा आया मैम, बहुत मजा आया. थैंक यू सो मच. और आप आए ये सब होने के बाद सर के, तो मुझको बहुत खुशी हुई. हमको पता था आपको थोड़ा टाइम लगेगा बाहर आने के लिए, बट आप आ जाए, बहुत अच्छा लगा मैम. इसीलिए हमने थोड़ा पोस्टपोन किया आपके लिए, थोड़ा पोस्टपोन किया कि नहीं मैम जब बोलेंगी तब करेंगे.
Thank you.
थैंक यू मैम.
Thank
चलो,
you. Bye-bye,
टाइम टू
everybody.
लॉग आउट.
It was Ankita who insisted so
Yes.
much.